The views expressed on this show do not represent those of NTV or its staff.
You're welcome, honorable members, to this session of the NTV People's Parliament, seated here at the Royal Suites in Bugolobi. It's a platform where Ugandans come together to share views that affect them and issues of national importance. Agnes Nandutu, the Speaker of the People's Parliament, presides. Madam Speaker, health is one of the most crucial sectors in an economy, and according to the budget speech of the financial year 2014-2015, the health sector share of the total budget reduced from 8.6% to 8.4%. Madam Speaker, we understand that all health issues cannot be catered for, and thus priorities must be set. I therefore beg to move that we discuss health for all. What should be our priorities beyond 2015, and how can citizens be involved in accountability?
Those in favor, aye. To the contrary, no? Aye. Ayes have it. Honorable members, as you're aware, health of the population is very important because for any state to develop, you need a health population. Being a developing country, the budgets are inadequate, and so we need to prioritize. Honorable members, where should the priority be? Should it be maternal health? Should it be HIV, malaria, or cancer? It is you to decide, the citizens of this country. Before we get the ball rolling, may I call upon the expert from Ribbon Alliance to give us some expertise opinion. Please, honorable member, you're welcome to NTV People's Parliament.
Thank you very much. I would like to specifically point out that the health of mothers and children. Mothers and children are really the foundation of any nation. Without healthy mothers, you cannot have healthy children. So we think in this post-2015 agenda, we should put a lot of emphasis on the health of mothers and children. Yes,
to what extent do you think Uganda has achieved?
For example, we have managed to reduce child deaths, and although we have not achieved the targets we have set, we have done very well. Regarding the deaths of mothers, we have not performed so well. Today, our maternal mortality ratio stands at 438 per 100,000 deaths. That's very high. Our newborn deaths have also remained high. Although we have reduced child deaths, we have not reduced the deaths of children under 1 month. And we think maternal health and neonatal health should be given priorities.
Thank you. You have heard from White Ribbon Alliance. She says the health of mothers and children should be the priority. What does the Minister of Health say?
Madam Speaker, honorable members of People's Parliament, I am Honorable Placid Mihayo, Minister of Health. I want to specifically address the issue of Millennium Development Goal number 4 and number 5, which were touching mothers and children. And there are so many factors why the country we have not done very well on these MDGs, in a way that there are so many factors which affect the service delivery in terms of providing emergency obstetric care to our mothers. And this one is the one which has mainly affected even why the perinatal death or death before a child reaches 1 month has remained high, because majority of our mothers are not delivering under skilled health care. And our priority to address this is mainly to to focus on recruitment of midwives for Health Center 3s and Health Center 4s. Then the another point is that we feel we should also functionalize the Health Center 4s which are not providing what we call comprehensive obstetric care, where we have doctors, anesthetists, and midwives, so that we can provide cesarean sections to the mothers who need them. And that one is going to be another priority for us as Ministry of Health. The third priority is to provide, Madam Speaker, what we call life-saving commodities, because we know the causes of maternal death and neonatal death, and the major one being postpartum hemorrhage, and one of the drugs which is among those for life-saving skills, rather life-saving commodities, are Pitocin, misoprostol, and then also antibiotics to address neonatal sepsis. So if we provide all those in our health units throughout the country, both in public and private, will be reducing the death of our mothers and children. The other point is that we want to mentor our health workers in emergency obstetric and neonatal care, while we are also involving what we call helping babies breathe. And all of the midwives and the nurses who work in all our health units to be oriented in the modern techniques of helping mothers to breathe, and also for how to look after the premature babies, or what we call preterm babies, by the use of kangaroo method, and also those who need referral, how they are going to refer them to the centers where they can be looked at.
Okay, doctor, thank you so much. I think we are moving. I will give you another opportunity to come and expand on your points, but it is clear that the Ministry of Health is also putting maternal health as a priority in this country. Thank you so much, and we hope you allocate enough money to that sector to ensure that the lives of mothers and our children are saved. Yes, let me hear from the church.
Why focus on health and to the mother? Because God said, go and multiply and fill the earth. And the task, the most important task was given to the woman. She's the one who does the donkey work for producing all these men of you. And the first thing I want to propose to the government and to everybody in Uganda is that we set aside a day to celebrate the joys and pains of motherhood. That we set a day when we pray in all our churches to thank God for mothers in this country. You have a risk when you're pregnant, it's a terrible risk. You can't predict whether to make it well through the pregnancy, or when you go to the delivery, or even after delivery. Therefore, we want to ask the Lord himself, who allowed us to multiply on the earth, that he will take care of those mothers who are giving birth to us. The second point I want to raise is that we don't want to stop child mothers. This is a country where in Kayunga the other day, we read in the papers that a boy of 16 married a girl of 13. And they were arrested when they went to antenatal checkup and said, "You are too small. How old are you? I'm 13. Then the boy said, I'm 16. He said, "How come?" And they were arrested. I think there must be a way of addressing this particular issue, and I'm proposing that we aggressively go to schools and talk to our younger ones, the children. The little ones should learn in time that you should wait until you're old enough to engage in sex and be able to produce children when your bones are strong enough to hold a baby. I think they should arrest the parents in this case, isn't it?
Okay.
Our vision is to improve health of mothers and children. So addressing these two areas.
Okay.
And we pray that the Lord will help us to this.
Thank you. Thank you, man of God. Let's hear from the nurses, please.
Thank you, Honorable Speaker. Talking from evidence, Rwabahima Florence, a retired midwife, but an activist member in Midwifery Society. Madam Speaker, point as we go beyond 2015, one, we must have a well-trained, that is a quality training for a midwife. It's key. According to Earth World Organization, one midwife is supposed to serve 6 mothers, but today they are serving 100 mothers. Can you imagine that? As we recruit these well-trained midwives, we need to motivate them. One, let there be a salary scale where they can also work with others on the markets, looking for whatever they can keep on. Let there be improved conditions. Which are these? Houses for these midwives, well working conditions, enough equipment and supplies. Since these midwives are the doorkeepers for a healthy and alive babies, even a well cared of dead body. Remember, whether we like it or not, somebody must die. But who is this midwife, nurse caring for this mother? Doctors here, you bear me witness, never in life, this is in my experience, will ever doctor come near a mother before a midwife touches this mother, this baby. Two, can we have services nearer to these people and let the communities be involved? A third point, this is a request to the Minister of Health. If we need to tackle maternal and child services, can the minister strengthen the office of the nursing and midwifery in the Ministry of Health? For a long time, it has been a one-man's office. Yet the health force for health services above 85, they are nurses and midwives.
Okay.
So we need to recruit well-trained cadres in the Ministry of Health, well-motivated, who can go down and support and supervise service delivery for a better conditions, for better services for this nation.
Thank you.
I beg.
Thank you, ma'am. Those are very well elaborate points. I think it is time that we hear from Parliament. What are you going to prioritize for the health sector in this country?
Thank you very much, Madam Speaker. Madam Speaker, I'm Milton Mouma, like you've said, representing Parliament, but specifically Chigulu South Constituency in Iganga, and a champion of maternal health. Madam Speaker, I wanted to agree with the retired bishop, but in one way, somehow differ. Why he said, the Bible says, go, fill the world, multiply and dominate it and eat it. But my school of thought now talks of us managing the families, the numbers, by providing for family planning, having a specific budget line for family planning. Because this is the way to go. If people just multiply the way they feel, I think this country will be endangered. So let's look at the numbers. By providing for that unmet need, because in our preamble we talked of unsafe abortions happening everywhere. But why are they coming? Because there is an unmet need, whereby contraceptives are not readily available to most of the people. So if at all we provided these contraceptives, I feel people will be able to take them and reduce or go for wanted pregnancies instead of going for unwanted pregnancies. So I feel this is the way to go. As we talk, the chairperson of LC3, Namugongo sub-county in Kaliro, the wife is being buried today because she died giving the eighth birth. So because she hadn't willingly or voluntarily consented to this pregnancy, she didn't fare well and she had to pass on. She succumbed yesterday and they are burying. So I feel we need to do something to this. So as Parliament, we need to push and advocate for a special budget line for family planning. Madam Speaker, the other issue is to do with the nutrition. Children are getting stunted. They are dying of malnourishment. Even at the first, before they make the first year, they are dying because of poor feeding, poor diet. So as the parliament or as government, we need to urge ourselves to ensure that we come up with a nutrition act or law, because there is a policy, but there is no clear law that compels us to ensure that children are well fed in this country. Madam Speaker, I thank you very much.
Thank you. Let's go for a short break, and when we come back, we shall deliberate more on what we should prioritize. Should it be the labor wards? Should it be the mother kits? In which sector should we put more money? Welcome back. You are still watching NTV People's Parliament, discussing a very important topic, the matters of health. And as citizens, we are looking on where we should put our money. What should be our priority beyond 2015? Members in this August House are suggesting it should be the health of mothers and their children. Let's set the ball rolling, yes.
Thank you very much, Right Honorable Speaker. My name is Okeyo Peter, MP Bukoli Islands, including Mijingo. Right Honorable Speaker, I represent 58 islands, and with only one health center 3 and around 6 health center 2s. Referring a mother from one island, from a health center 2 to a health center 3 is a problem. We have to use boats, sometimes use canoes.
Do they move at night?
By the time they move at night, when the mother reaches the health center 3, you know she will be history and the child will equally be history. I want also talk about retention of a girl child in school through UPE and USE. This one will also help us to keep these mothers, these would-be mothers, young mothers in school, and would also help to make them ready at the time when they need to give birth, when they are ready. Then youth-friendly services and information. Right Honorable Speaker, without fear of contradiction, I want to say and request Bishop Emeritus that one way to look at is the use of condoms and promotion of condoms in schools. Thank you very much, Right Honorable Speaker.
Thank you. Do you agree with that, Bishop? Is it true, Honorable Member, that midwives are always rude to the mothers who are giving birth?
We are not rude, but we are just, we are exhausted. We are stressed. I'm requesting the public to encourage girls to take up science subjects, because midwifery is a science profession. So we are encouraging you, encourage the girls to join us, so that we have a big number in the hospitals. Okay. We should support the midwives until their death point, to see that they are offering quality services at the community level.
Thank you, Honorable Member. Yes, Hajat, I know you are a mother.
I thank you, the Right Honorable Speaker. I'm called Nanso Garuchia Nyombi, representing the grassroots Muslim community from Nakawa constituency.
You're welcome.
Yeah. I'm calling upon the honorable members of parliament. We are there to support you. If you come at the grassroots level, come down and see what is taking place. We have very many health centers, very many clinics with unqualified health workers.
Where do they come from?
In our communities, because the health setting is not facilitated. So I'm calling upon the Ministry of Health, please, let us train, retain the health workers.
Just a moment, Mother. Doctor, how is it that there are unqualified people at health centers? You have no management over these health centers that you have unqualified
They don't supervise.
People? No supervision?
No supervision.
Madam Speaker,
yes,
and honorable members, the issue of mushrooming clinics in so many places of our country, including slums within the city, is that our councils are still weak. They are not well facilitated to do proper supervision. And then also, we still have a law which is in the process of regulating also the the traditional healers and so forth. Because everybody now these days can open a clinic
So
and
it's
start
the
advertising.
mushrooming clinics that are employing unqualified people in health centers?
No, not in government. They are private. Everybody stands, like the way people are opening private schools. That's the way how people have also gone.
Information.
Yes.
Yeah, now what's the role of the ministry?
Are you not regulating
This business of sitting in ministries, in their offices, not going to the grassroots, that's why we are losing mothers. Recently, last month,
yes,
I lost a mother in my community.
What I have said is that the councils are there to regulate, and all the clinics which are supposed to open should be registered. But because the councils are thin on the ground, some of the clinics are operating without being what? Regulated.
That is
But
unfortunate.
the council they are very active. You have been hearing them closing so many clinics and hospitals in different districts.
Okay,
But again,
thank
when
you.
they go
Thank
away,
you,
they are
doctor.
closed.
Just as the citizens are saying, you should leave your air-conditioned offices and go to the grassroots
Yeah.
ready to monitor the facilities.
Now,
Yes,
another
go ahead,
point.
doctor.
Another point.
Thank you.
Another point. Now, as the Muslim community, people down there, they always say that Muslim, they marry off young girls. But the majority of mothers that are dying is not in the Muslim community alone. Let us join hands.
But is true? Is that true?
According to our Sharia law, a girl, when she's ready to get married off.
Okay.
But.
What age is ready?
Above, yeah, 18 and above. 18 and above.
What is the information?
Right Honorable Speaker, I come from Utaleja and a member of Parliament for Bunyole West. I wanted to give my colleague information that the Muslim community, really they are doing that, and as we talk now, we have arrested some couples. They are in prison. Of recent, we got a couple, one was 16 years of age, and the girl was 13. So right now they are in jail. So we need to revise that.
Unfortunate. Thank you. Unfortunate. Thank you for that information. Yes, ma'am, go ahead.
I'm Honorable Pros Blega from CSI. My observation is, as they are saying that they are monitoring private clinics and hospitals, but public health centers and hospitals are not monitored. When you go to these health centers, you find nursing assistant heading a health center too. And again, what I'm requesting the government, let it, as is monitoring private clinics, also monitor public clinics and midwives. Midwives should go door to door. That's what we are doing in our community. And give health education to families. Yeah? Families, it is the first community to see that it has to reduce maternal mortality. How? Okay. Who is a girl child? Point of information. A mother starts from a girl child.
She's giving information to herself.
Yes, for you. I'm sorry. To be a mother, you first to be a girl child. Who is a girl child? A girl child has to be well fed, good nutrition, so that the pelvic bones are well built. To be ready for what? For giving birth. But you find that a girl is prevented to eat proteins like eggs, is what, because of culture. So let us start from families. Let's get families to make a girls get good nutrition, get health education, and then we go to the government. Thank you.
Thank you. Thank you. You have heard from a nurse. She's a midwife, I think. I think, doctor, you should note that point such that you take it back to your office. We also have doctors here who are also legislators. Can I hear from Dr. Lulume, please? Take up the podium. You are a doctor, but you are also a legislator.
Thank you.
Can we hear from Parliament? How are we going to save the lives of our mothers and children?
We shall not be able to save our mothers and children. The situation is going to become worse, and it comes on the backdrop when Uganda was preparing to export about 300 health experts to Trinidad and Tobago.
Haven't they already gone?
Not yet, but there is a lot of water going under the bridge, which we may not be able to comprehend at the moment.
Thank you, Right Honorable Speaker. I just wanted to allay the fears of the Honorable Rume, because when your office recently called the Committee on Health, Madam Speaker, you were concerned about how the health budget can be played around with to ensure that maternal health comes out. And you appointed a committee headed by the then Honorable Baryomunsi, who is now a minister, a 5-man committee to go and look into the health budget and see how we can reprioritize, because there are some issues you can see that this is not really necessary, and then bring a report on the floor.
And what was the outcome of this?
The committee is finalizing the report. It's yet to come on the floor.
But according to preliminary reports, are you prioritizing maternal health or?
Yes, because the reality is, like Honorable Rume is saying, that the budget was reduced. So that is why now Speaker had to go ahead and say, let us see what we can change within the budget to ensure that more funding is put into maternal health, because life is important.
Thank you, Honorable Member. Let's hope that will be done, because we need to save mothers. If you don't save mothers in this country, then you will have no nation. Go ahead, Honorable Member.
What I am saying, if at all the budget is cut to that extent, yet we have been seeing a lot of unfunded priorities. Unfunded priorities which involve the preventive health care, preventing people from becoming sick and getting conditions that kill them, which include, and not limited to, the nutrition that you're talking about in schools. You need to have a protracted struggle on health literacy. It must be a 15 to 20-year health literacy campaign to enable people to be health-wise literate, to understand why they must feed, why they must even drink water, why they must avoid lifestyle diseases, including cancer.
What is it,
why they must, why?
You want to give information to Honorable Member, please.
Honorable, 570 girls and women between the age of 15 to 24 get HIV every week. Yes, get infected with HIV. And that means there are two problems. HIV comes with other STIs and unwanted pregnancies. So now, can we please have reproductive health as a subject in that campaign? Because like the government put entrepreneurship from commerce in the school curriculum so that we have more entrepreneurs to reduce on the recruitment of jobs. So likewise, can we have reproductive health as an independent subject of its own from biology, just like entrepreneurship came from commerce? Now, also society needs to empower men much more than even the women. You should come out and tell the boys, please use a condom when you're having a girl who is, to protect both of you. So because the girls were not empowered to talk.
Okay, thank you, Honorable Member. I think that
what a brilliant point of information. It was one of my ideas which was coming next.
All right, go ahead, Honorable Member.
The issue of reproductive health to the 12-year-olds up to the 16-year-olds cannot be overemphasized. We should not even encourage children to have sex, even at all. We should, as much as possible, tell our children not to engage in family-making matters before they attain the age of the majority.
Yes. Thank you, Honorable Member. Let's go for a short break. And when we come back, we are going to hear more from the mothers who are going to these facilities and the children who have also lost their mothers in the course of giving birth. Welcome back. You are still watching NTV People's Parliament, discussing a very important topic. What should be the priority beyond 2015? And their priority is maternal health. Honorable Member, you have the floor.
Madam Speaker, we must first of all appreciate that we all came from mothers. If we are sincerely to say we love mothers, we are just talking. In practice, people are dying. Honorable members, last month, I referred a lady, a mother, who was on labor pain with one hand of the child outside.
Are you a doctor?
I'm not a doctor, I'm the district chairperson.
Okay.
I had to do it because we had no ambulance in the district. And I have been doing this for quite some time.
Did that mother survive?
Yeah, she survived and she's there very healthy with the child. My humble appeal is that whoever has the capacity to help these mothers, please, let's join hands and help them. Then we complain later. Madam Speaker, and we
Somebody wants to give you information?
I'd like to inform the current honorable that this government has the capacity to do everything for the health sector, except that there is no political will to allocate resources to the health sector.
Thank you very much for the information.
Yes.
Madam Speaker, on the 14th of this month, we registered cases where mama kids were being sold to mothers in the maternity wing. As we talk now, the case is in police. But the way police also handles issues in relation to health is
Midwives,
alarming.
why are you selling mother kids to
It's
mothers?
alarming.
They are given free from government. Why do you sell them?
Some people are saying for survival. But sincerely speaking, it's unfortunate that everybody found in the hospital is labeled a midwife. Because I remember when I was still working in Mulago, we used to deliver mothers. Then outside there's very clever people. Once you deliver, they say, yeah, this is a girl, they must want soap. And you will never see this soap. And the people outside there are making business.
We are told the mother kids are sold inside the hospital by health workers. You, the health workers.
Yes, I can't disagree because not everybody is a holy person in the health. Because some people, yeah, it's very true. Some people, I used to see a midwife who was sharing the food of the patients because she had five children at her home, and she was going back without anything. I don't know whether they are tempted or not.
Okay,
but
thank you. Thank you. Please, midwives, our nurses, don't be tempted to sell the mother kids to the mothers. Okay.
Madam Speaker.
Well, I will give you another opportunity. Let's give the opportunity to the children to speak. Yes, what do you have to say, ma'am?
Thank you, Speaker, for this chance to talk. I'm on the side of the White Ribbon Alliance because my mom died when I was giving birth to my baby brother. Because it was not because she did not have, she was missing a mother kid. She had it. Everything was there. She died because that hospital did not have blood to support her. She bled to death. And my brother now has a brain damage. Nothing.
Okay. It's a very difficult moment. Please take a minute to submit your points.
Honorable Speaker, I'm called Honorable Marcia Tizio. I'm a youth community advocate and I represent the young people of Uganda at large. I stand here as a voice of the young people in our different communities. The young people are tired of the different circumstances surrounding them, such as the early unintended pregnancies. We do not want to get pregnant and drop out of school because we value education. But because of the services that are not rendered friendly to us, that is why we drop out. For instance, when we go to the medical centers, some of the health workers are too rude to us, even when we want to seek these services. And because we don't have accurate and right information, we can't make right decisions. And
which services do you go to seek?
Sexual reproductive health decisions, information. Yes. We want to know whether it is right for us to have sex. So if we go to these kind of medical centers and we don't get the right sexual reproductive health information, we are prone to making mistakes in life, and that at the end of the day makes us outcasts in our different communities.
Thank you. You have had midwives, please. Listen to these young girls.
Thank you very much, Honorable Speaker.
1 minute.
First of all, we would want, when they are going to New York in September, those that are going there should not go there without information from us. We should be involved. It should be a bottom bottom-up approach. Number two, enough is enough for death of mothers and for young children. In the 21st century and in a country in Uganda, enough is enough. What am I saying? Excellent comprehensive emergency care should be in all the health center force. And then the basic one, in the health center, 3s. I am saying excellent, not divided.
Okay,
because
ma'am.
a survey was done, and actually the service is very poor. Now, empower us, the citizens, to demand for what we need, and then empower us to hold the leaders accountable for what they have spoken that they will do for us. Thank you.
Thank you,
no
ma'am.
point.
How can you be involved in accountability?
Thank you, Honorable Madam Speaker. I'm called Caroline Washaba, representing Action for Youth Development Uganda, Mbara District. We realize that Uganda has failed in the MDGs, and now we have called them Sustainable Development Goals. We cannot have any project sustainable if we don't involve the community. And again, we should also look at our legislators. They have made many commitments which are summarized, and they all stop at the parliamentary level. We request that our parliamentarians should interpret and summarize whatever they discuss in parliament so that it can be easily interpreted at the grassroots,
Okay.
because many things are being discussed and they stop on that way. Thank you very much.
Thank you. You have heard. You are talking in parliament and stopping there. You are not going to the population to explain and maybe make implementation. Yes.
Thank you, Madam Speaker. I am Dr. Twatwa Jeremiah Mtwalante. I represent the people of Ikiki constituency in Budaka district. I would like this country to have a very good ambulance service program so that we can carry women, particularly pregnant women, from their homes or from our health facilities to the bigger health unit.
What action is Parliament going to take to ensure that government does that?
Parliament is going to hold the government responsible and ensure that they increase the budget.
Thank you.
Can I conclude by saying that the other aspect which needs to be looked at is the legalization of safe abortion, because
you want
24% of the maternal mortality is actually caused by unsafe abortions of teenage children.
Okay, do you agree with that? Bishop, do you agree with his submission? Just in less than a minute.
The little ones should not get pregnant in the first place. And we should emphasize that point. That as the Honorable Rulema was saying, no girl should get pregnant before she's 18.
I would like to talk about doctors and nurses plus those midwives who have been coming here, deceiving us that everything is going on well. But when they reach there, they carry out embezzlement of things used in hospitals to take care of mothers. I can give a good example of a woman in our village. There is a hospital. It is found just within the town. It is a private hospital, but when the owner went to Nairobi, he left there the person to help him to head other people who are working there. But that person also said, why can't I also start stealing things and I also make my own clinic to get money for free?
You see? So doctors and nurses, you are selling medicines in hospitals that is supposed to cater for the children. Thank you, ma'am, for that point. You have heard, that is the voice of the child. I want us to talk about the citizens' involvement in accountability. Please, in 1 minute.
Thank you, Madam Speaker. My name is Makwas Derek, representing Uganda Youth Development Link. Citizens are not informed. According to research by UNICEF in the Wikipedia encyclopedia about Uganda's maternal health, people are not healthy literate. However much the Ministry of Health provides the medicine, provides the services, when people are not informed, no one will consume those services.
Okay.
What are the village health teams doing? They are not being monitored. They are not being mentored. They are not being motivated.
Okay.
We, the peer educators, we are not being looked onto as a tool. The youths outside there are suffering.
That's
just
a very
because of-
good point. Thank you for that wonderful point. Yes, Honorable, how can citizens be involved?
Thank you very much, Madam Speaker. Some of these issues are pertinent, and we are not talking from blue. We know people are dying, like the young girl from school who said we don't have information at all, and yet the information is there. The president had to put enough information in primary schools and secondary schools under PSA program. In schools, we know ABC. If you are a girl or a boy, why do you commit yourselves into sexual affairs and you are not committed for marriage and underage? This is very bad. And Madam Speaker, before I leave this podium, let me inform the citizens of this country that as we talk about issues of health, Madam Speaker, if this country is not secure in issues of security, we may think that people will die because of maternal mismanagement or health, but Al-Shabaab will come here and kill people without security. Secondly, Madam Chair, you see,
Order, honorable members, order.
There is an issue that Dr. Lulume raised in this parliament that the budget cut is there. He did not give you information why the budget cut. Let me inform you, we are at a threat of Al-Shabaab, number one. So government is protecting its citizen. Number two, Madam Speaker, to finalize.
Order, honorable members, order. Yes, ma'am.
Honorable MP, with due respect, I want to let you know that, are you aware that 377 billion is being used on VIP health care for you people abroad? Are you aware of it? Thank you.
Madam Speaker,
yes.
The question was very clear. She asked, are you aware? My answer is also very straight. I'm not aware.
Okay, honorable member, can you conclude?
Yes.
Order in the House and you conclude.
Colleagues.
Order. Yes, conclude, honorable member.
Madam Speaker, as a leader in this country and representing people, I have to assure you that in my constituency where I represent, people demand a number of issues. They demand roads connecting to health centers. And if government allocates some funds to put in place roads, it's very important, and we are helping the health sector.
Okay,
water,
thank you.
without clean water in our areas, people want boreholes and piped water. So we should look also at water, Minister of Water and Environment.
Okay,
how much is
honorable
allocated
member.
there to
Thank you.
support the health of
Thank
our
you
people.
for that information. Thank you.
Thank you very much, Madam Speaker. My name is James Kinto. Like everybody said, citizens accountability is about social accountability, whereby citizens are involved. So, as we talk about the improving maternal and child health, all citizens must be involved in the following. One, they should be involved in defining the priorities at the time of planning. The citizens must contribute to the priorities, because what's happening currently is, I think, the technocrats decide what to plan and budget for.
And they don't know what is happening on the ground.
Exactly.
They are deciding from the air-conditioned offices.
Exactly.
Go ahead.
Number two, the citizens must participate in the implementation of these plans. So the consumers of the services must participate actively. Then number three, the citizens must participate in monitoring and also demanding for accountability in terms of where resources have gone and also whether resources have been put the right use.
Okay. Thank you. The citizens have spoken and you have heard. You should also be involved in accountability. If they sell a mother kit to you, refuse and report that person to police. If a nurse is barking at you, go and report her to police. Why should you keep quiet? Please be involved for the better health of our nation. The leaders that be, you have heard The citizens have spoken. The priority is maternal health. Without health mothers, we cannot have a nation. I'm still Agnes Nandutu, the Speaker of this Parliament. Until next Saturday, I adjourn this House.
The views expressed on this show do not represent those of NTV or its staff.